Hi, welcome to Addiction Recovery Place podcast, the podcast champion addiction treatment professionals around the world. I'm your host, Chris Langley, and I'm very pleased to introduce today's guest, Eric Ekberg. Eric is the CEO of Granite Recovery Centers based in New Hampshire and Maine. Eric is a successful CEO with 3 decades of experience in financial services and addiction recovery. Eric changed careers about 18 years ago to fulfill his passion to help others affected by mental health and substance use disorders. Welcome to Addiction Recovery Place podcast, Eric. It's great to have you with us today.
Thanks, Chris. Thanks for having me.
I really appreciate you accepting the invitation to come on today. I'm really excited to talk to you and to hear about your work and about your recovery centres. So firstly, can you tell us about yourself and your journey to becoming the CEO of Granite Recovery, please?
And you hit on it a little bit. Been doing this work for about 18 years now in substance use disorder treatment. It's a second career for me. I started many moons ago. I hate to admit how long it's been, but I was in finance, investment management, banking was my first career. And long about 20 plus years ago, I found myself needing treatment myself. Things got a little rough. I didn't treat myself very well in the sort of late 90s. And I was fortunate enough to have a lot of good people around me. And I found myself needing treatment, and I pursued that. It wasn't a one and done, unfortunately. I wasn't one of those lucky people. So it was a few treatment episodes. I finally, the light went off. And when I landed on my feet, I said, you know what, I want to do something different. And decided to get into this career because so many people helped me out. I thought it was a purpose to my life to give back and to pursue working in this field. And I literally started at the bottom. I was at a state-funded detox facility in Massachusetts, started as a case manager, sort of rough and tumble, getting people into treatment and helping them navigate that. And because of my background, I sort of moved in the direction of management. And over time, I started running those programs. I ran a residential program in the same facility shortly thereafter. I think 4 or 5 years after starting at that site. And then I ran a couple of other residential inpatient facilities in the state of Massachusetts and really found my niche of treating people that need inpatient level of care. 3 years ago, there was a change at Granite. It was privately owned or sole ownership. There was an acquisition and they needed somebody to come in and sort of navigate that as the leadership left. So I'm very fortunate to now run Granite Recovery Centers. It's coming up on 3 years right now.
Wow, goodness me, that's one incredible journey that you've been through, going from financial services to going through treatment yourself, and then now you're CEO of a incredibly successful recovery centre. That's really impressive stuff. I'd just like to talk about the program at Granite and kind of what makes it so different. So can you tell us about some of the programs that you provide?
Yeah, so Granite, we operate 4 facilities in the state of New Hampshire. 2 in the southern part of the state of New Hampshire, 1 sort of in the middle of the state, and then our what I would call our flagship location is up in the White Mountains, sort of in the northern part of the state. And that's called Green Mountain Treatment Center. It's where we do, quite frankly, the most treatment. It's where we have the most beds, where we have the most employees, and it's a full continuum of care, detox level of care, residential, and then we offer partial hospitalization as well as intensive outpatient treatment. So the beauty of that is we can keep people in treatment upwards of 60, 90 days. And I think, as you know, Chris, as people who have been working in this field, and all the evidence, all the research points to this, the longer we can keep people in treatment, the better the outcomes. So we're a strong proponent of getting people not only in the door, but to let them hang in treatment for a reasonable amount of time to drive those better outcomes. So we do that up a fair amount at Green Mountain Treatment Center. We have 2 locations in southern New Hampshire. One is called the Granite House. It's in Derry, and that provides a detox level of care in residential. And it's mainly for Medicaid population. So we get people, it's 38 beds total, and we can flex between detox and residential. And again, the beauty there is we created another facility, actually where I'm sitting today in Salem, New Hampshire, which is outpatient. It's partial hospitalization and intensive outpatient. So you go to the Granite House in Derry for detox, residential, and then ideally you step down to our program in Salem. It's called New Freedom Academy, and do outpatient treatment. So again, ideally we're hanging on to our clients for 60, 90 days, full continuum of care. And the outcomes are so much better when people really stick in treatment versus, and we've all heard the stories. Oh, I'm going to treatment, and they go to a detox for 5-6 days, and they're back out, and that's not treatment. That's some of the terms we use, and I'm sure you've heard it. Spin dry, and unfortunately that cycle just continues. So we're trying to break those cycles.
Mm-hmm. So you offer a very extensive service from detox all the way to. Do you do aftercare as well?
Absolutely. That's sort of the key to it all, right? And we really, where I see that the most, I mean, for the most part, people go to Green Mountain. It's commercial insurance or private pay, and most people that enter that facility, those levels of care, traditionally have a job, have families still in their corner, have a place to go when they ultimately leave treatment. Clearly, we're still setting up aftercare, whether it's ensuring that they're pursuing whether 12-step work or other modalities or continuing outpatient, ensure they have a network to be connected to when they leave. But where we really see the need for, in my opinion, stronger aftercare is with our Medicaid population in our places in Derry and Salem. And the reason I say that is, and I've had meetings with, for instance, the mayor of Manchester, where we have 6 recovery residents. So people go to our treatment facility in Derry. And again, most of this population, some of them are homeless when they come to us or out of work. Things aren't going well. We do a pretty good job keeping them in treatment. We step them down to Salem. They're staying in outpatient. We can house them in our sober living facilities in the city of Manchester. So they're with us for 60 days. However, once they leave our treatment sort of security and bubble, if they don't have a job, if they don't have transportation, if they don't have a network, it's sometimes very self-defeating. And we see these folks saying, what the heck? What's the purpose? What do I got to do now? So we really work with getting people, again, connected, ideally getting them back to work, helping them to get to a job market, getting in front of people, meaning transportation, et cetera. So there's a lot that goes into this, and we do our best to make sure things are done appropriately.
It certainly sounds like you're doing the right thing, that's for sure, because it's always a frustrating part, like you said, finishing treatment and then what. So that's wonderful to hear that you provide that.
We've all heard this, seen the stories, heard the story, and then they're just back in the same spot. And, again, it's sort of, people get the efforts, we all know what that stands for. And, and then they're back in treatment. hopefully back in treatment. Sometimes we're not as fortunate. They don't make it back to treatment, and the outcomes are horrific. So.
Mm. Yeah, I've looked on your website, and you have an extensive team at your facilities. It just looks amazing. Can you tell us about some of your team members who are working at Granite Recovery and some of their roles, please?
Sure. It's funny. I've been here about 3 years, and one of the things that attracted me to Granite, I was down in Massachusetts. Not that it's that far away, but Granite always had a really good reputation for the work they did, the staff. And we have a very high percentage, and it's not unusual that people work in this field are in recovery themselves. In most cases, it's the majority of the staff. At Granite, I would argue it's the vast majority. So we have a lot of really dedicated, committed individuals. And not to say if you're not in recovery, you're not doing great work, because we have plenty of those folks as well. Or we have a lot of people that are in recovery that are just committed to our mission. So we have a couple of key areas, and at all of our locations, we've seen people advance. People come to us, and I'll give you a couple of examples. Our director of admissions was a recovery specialist at the Green Mountain Treatment Center. That was his start, and he was a go-getter, really smart, really good with managing data, et cetera. And lo and behold, he's now the director of admissions. Our director of nursing, similar situation, started at as a nurse, sort of worked her way as a supervisor. Lo and behold, she's now director of nursing. Our executive director at our Granite House started as an RSS, became a case manager, became a director of operations, and is now the executive director. A lot of examples of that, where people just work hard, are committed, and now they're leadership. So when I have a leadership meeting, most of the folks have been with us a fair amount of time, but not only that, they've held many different roles, which is, again, similar to sort of my story, but I didn't do it all at Granite, whereas many of these people did. So it's really a good story.
Most definitely. It's always inspiring to hear these stories, and obviously yours, and you've just told me about a couple of your other team members that have done the same thing. And it's always nice to hear, because there's always a certain passion, extra passion behind someone who's gone through the treatment themselves, and they know exactly the feelings, and it's always very empowering, I think, for clients to hear that as well.
I couldn't agree more. And, it's a difficult job. The people come to us, you got to take a step back. So people are coming into treatment. So many things are going wrong for them, right? Not only do they feel horrible physically, the chances are they have, employment problems, they have financial problems, many have legal problems, probably medical problems, or certainly relationship, family issues. So they come in our door, and we're smiling and saying, "Come on in. This is going to be great." And they're not buying into it right away. They're miserable. Like, I got to be here, and this intervention in my life, and oh my God, and they get the world on their shoulders. Somehow we've got to change that narrative and say, no, this isn't the worst day of your life. In fact, this could be the best day of your life. And that needs to be the message, because it's so critical when we get our people that come into our door to hang on to them. It's not uncommon for people after 2-3 days, they feel, hey, I got to get back to work. I got to get back to my family. And we know that cycle will just repeat itself if we can't hang on to them and say, listen, stay the course. There's a lot to learn. Stay in this bubble of safety while we work some things out, so you can make the necessary changes to not come back. That's the ultimate.
Yeah, I love that. You just mentioned families, Eric, as well. So do you work with family members of people that you care for? Is there a family program or support that you offer?
100%. It's critical. As we all know, the disease of addiction is a family disease. It affects not only that person that's abusing, drugs and alcohol, but everybody around them. So when the family's still in their corner, and many cases, if not the majority, they are. They may be angry or just had enough, etc. But if somebody is willing to go to treatment and be committed to a longer term stay, we generally find out the family's like, yeah, I'm supportive. As long as they stay in treatment, what can we do? So we'll work with those family members as best we can with, weekly calls, updates, family visits, if necessary, family interventions, counseling with their client's clinician to make sure everybody's on the same page. And we try to communicate people or with family members to let them know what their progress is, what we recommend as far as the next steps. So it's really important to bridge those gaps, because sometimes our clients aren't telling their family members everything they probably should. So it's a healthy way to reconnect people.
It must feel like a big weight off the shoulders for a family member to find such a wonderful service as yours that offers all of this, all of these services that you do. It must be very lovely.
Well, it is. And most, we always say to clients that, they may want to leave early. Hey, I've been here for 2 weeks. It's like, one of the things we say is like, you know what? Your parents are finally sleeping well. They haven't had a good night's rest in God knows how long. Let them be. Their level of anxieties come down significantly since you've entered treatment. Just stay. Give them a break. But conversely is when people do leave, it's not nobody's cured, right? We know it's the disease of addiction. We can put it in remission. People can be sober and in recovery for the rest of their lives, and that's the name of the game. However, they're not cured, so they've got to be vigilant, and we need to make sure the expectations of the family members are in check. They're not. It's not just all roses when they leave, so to speak. So again, making sure expectations are defined when a client goes back home.
Yeah, most definitely. So if someone wants to enter, if someone wants to come to your treatment centre, what's the process for someone to? So how do you receive referrals?
Well, it's real simple. I mean, the best way, in my opinion, just go to our website, graniterecoverycenters.com. Right on the front page is an 800 phone number. You'll be immediately connected to a live person, admissions person, who's very knowledgeable, not only what treatment we can offer somebody and help them navigate whether we're the right spot for them, which, if it's traditional SUD, then I would argue we're one of the best. But even if it's something else, if they just have questions, what other services, where else can I go? We're answering that phone so we can help people.
So if someone wanted to enter treatment, how soon could they get through the process for that?
We'll make it happen. Verifying benefits on their insurance. We'll make arrangements to get them here, transportation-wise if needed. So we want to make it as simple and as easy as possible.
I love that. That's amazing. I'd like to ask you about a service that you recently celebrated the grand opening of in New Hampshire's first and only residential primary mental health program at New Freedom Academy in Canterbury. Can you tell us about this and why you opened this, and what were some of the challenges that you experienced with opening this wonderful sounding service?
Well, I said at the beginning we have the 4 centers in New Hampshire, and I left that one out. New Freedom Academy in Canterbury, and we just changed the name. It's called Canterbury Behavioral Health, and we did that to make it more aptly named for the services we provide, which is primary mental health at a residential level. So, as you know, Chris, when people come into treatment, they come with a diagnosis or they meet the criteria of substance use disorder. Vast majority of the time, there's probably some underlying other mental health diagnosis going on, whether it's depression or anxiety, bipolar, etc. And obviously, they come to us. SUD is sort of what got them there, which we're trying to treat both disorders at the same time. Dual diagnosis is another term that we all hear about. At Canterbury, what we did is kind of flipped it a little bit. We said, why can't we just treat the folks that have a primary diagnosis of mental health, knowing that they probably have an underlying addiction disorder as well, but the primary diagnosis would be depression or anxiety or bipolar, get them into treatment at a residential level of care. We saw it too often, and especially with all the crisis going on in not only in New Hampshire, but throughout the country. And I think a lot to do with sort of COVID, post-COVID, a lot of people ending up in EDs, in sort of crisis. They may get admitted into an inpatient mental health facility. In New Hampshire, it's places like New Hampshire Hospital or Concord Hospital. And then they're there for, let's say, 5 days, 10 days, maybe longer. There was no step down that would be similar to substance use disorder, where you go detox, residential, outpatient. In mental health, it was just crisis intervention, inpatient, and then outpatient. There was no sort of in between. And we recognized that. We said, let's provide a residential level of care for those people leaving an inpatient facility, or perhaps their symptoms weren't enough to warrant an inpatient admission, but they could use residential. So they come to Canterbury, and we can hang on. It's a great spot out in the woods, very serene environment where we can hang on to people for 15, 30 days. Sometimes it's just medication monitoring, adjustments, but it's just time. Give people a little bit more time before they go back in the community or do outpatient treatment. So it's a small facility. It's 20 beds. And as sort of we predicted when we opened it up, we were full. It's eased up. We're running 90% utilization right now, meaning 90% of our beds are traditionally full. But it's really been a nice service for those people that have made it to our doors.
Yeah. Well, congratulations on opening that.
Thanks.
That's clearly a much needed service for your community.
It was difficult sort of logistically getting it open, but as far as going to the state and getting the licensing, I mean, it was not only did the state recognize that, wow, this is something that we need, and we were able to get a license fairly quickly, and kudos to the state to recognize the need for the service and help us move that along. But so that part was easy, but it was just sort of logistics and making sure the facility was up to snuff, so to speak.
Yeah. Yeah, you mentioned that you're able to open the facility relatively easily. So you obviously work with other agencies in the community. So who else do you work with? Do you have other partnerships in the community that you work with?
Yeah, it's many. Granite is the largest provider of residential inpatient SUD in the state. So over the years, we've developed really good relationship with, again, I just mentioned on the mental health side, EDs, hospitals, many police departments, many of the local politicians, right up, at higher levels at the state house, places like NAMI, which helps us on the mental health side, um, many sort of folks we call friends, including other treatment providers. You know, we, we talk a lot. There's you know, at a certain level, it's business, and maybe there's some sort of competition. There's plenty of people that need help. So it's a matter of making sure we're all doing the right thing. And I think by and large, at least what I see in New Hampshire, we've got a lot of genuine, not only good partners, but good citizens that are doing the right thing. I mean, we're again, providing a Medicaid level of care at 2 of our sites because, quite frankly, the margins aren't great. Everybody knows it. Reimbursement rates aren't all that terrific, but it's the right thing to do. And helping that population. And I know a lot of our quote unquote competitors feel the same way. So it's a good environment to do what we do.
Yeah, it's definitely. What would you say are some of the biggest challenges that you face in running your centres, Eric? We've heard so much about positive, everything's wonderful, but what would you say are the biggest challenges that you face on a daily basis?
It's staffing, especially on clinical and nursing. And one of the, I talk about the state of New Hampshire and in Green Mountain, up in the White Mountains. It's in a rural location, meaning there's not a big population up there. So, we've got to find and recruit really good individuals. So it's sometimes difficult to find enough clinicians or nurses that are looking for employment that want to work in Effingham, New Hampshire, which, isn't down the street. So that's a challenge. By and large, we do fairly well with it. I think we've done better over the last year or so. I think coming out of, COVID, there was a lot of telehealth stuff going on. And it continues to be that. And especially on the clinical side, a lot of outpatient providers that are doing telehealth that would gobble up they would hire away our clinicians, say, hey, you don't have to, you can work remote and do this treatment from your living room and just have a book of clients that you can work with. But it's not the same. It's in person. We lost clinicians that way. There was a lot of, I think in general on the nursing side, I don't think we have enough nurses entering the system to keep up with all the demand, not just SUD, but all the hospitals and, primary care. We need more nurses trained and educated. So we've reached out to some of the local colleges to see if we can do internships and get people up and running and into this field that way. And we've been relatively successful with it. I think we can do better.
I can imagine that's a really good idea about contacting colleges, though, with internships. That must be very attractive to students.
Yeah, they get well, it's a win-win. They get the experience, especially for clinicians, they get hours they can use towards their license. And we get good, hungry, ambitious young people that want to get into this field. Again, it's a win-win. So yeah, we do the best we can with it.
So where do you advertise your vacancies? Is it all on the website, or do you advertise?
On the website, all the job posting that are out there, all the traditional ones. We do our best to recruit and find good people.
Yeah, it certainly sounds it. I just want to ask about New Hampshire just for a minute. So how would you say your state is dealing with the obvious opioid crisis that's going on? What's going on?
Great question. I think, and you probably know this, 4 or 5 years ago, I'm trying to get the timing right. Not so well. I mean, New Hampshire is kind of known as per capita one of the worst places for opioid and overdoses. We made national news based on those numbers. And I think the response at the State House, at the governor's office, was good. Maybe it took too long, but I think they've done a nice job. And a lot of this just comes down to education, communication, getting the word out on what this available services were and what exactly the crisis was. I think it was like, oh my God, why is this happening? And cities like the city of Manchester, which kind of led the negativity of a lot of overdoses per the population, it was a heavy lift. But I think what they've done much, much better. And again, I mentioned it earlier, a lot of this, it seemed to have come out of, the lockdowns and COVID and a lot of the mental health stuff that was going on. There wasn't enough services. There wasn't enough education, outreach to affect all those people that they would seek opiates and heroin and all the alike. So they've done a nice job. And then lo and behold, we've had this sort of fentanyl crisis that seemed to have happened 2 years ago, 18 months ago, and that just spiked things up again. And again, it was a revamp of more communication, more outreach. So I think in general, they've done a nice job over the last 12 months, 18 months to curb it. Look, we still have a long way to go. We still have a long way to go. Yeah, there was 100,000 deaths last year for overdoses. Fentanyl still continues to be the number one killer of adults ages 18 to 43, I believe. Number one killer. I mean, think about that. It should be on the front page of every newspaper every day. And then yet, unless it's some big event, it finds its way to the back of you. So it's important to stay on top of this stuff. And it's our young people. It's our young people that are the ones that are dying. So we can all do better. That's the name of the game is to get the word out.
Yeah, it's great to hear that your state is actually, trying to deal with this head on as well. So I've spoken to some people around the country, and some states aren't quite as on the ball, should we say. And it's always nice to hear feedback from people like yourself that's, you're at the forefront of this, and, your state and your governor are actually trying to help. So that's really good to hear. Why do you think in this day and age stigma can have such a negative effect on someone wanting to enter treatment? Because I hear this time and time again. Well, stigma is still around, and it's mind-boggling.
I agree. It's funny. I think it's gotten better. Mm-hmm. I really do. I think I've been at this game I shouldn't call it a game, but I've been at this for 20 years. And it seemed like it was really, if you were a heroin user, an opiate user 20 years ago, it was different than it is today. The stigma was more significant back. And I think the reason why that's changed is because so many people are affected. Talk to anybody, and chances are, whether it's their immediate family or extended family or their neighbor, somebody has been impacted by addiction. So if you see, it's no longer in the rough neighborhoods of the inner city, it's in the suburbs, it's in the affluent communities. And by its very nature, if it's happening and it's that prevalent, then the stigma itself just, oh my God, I can't believe Johnny's, our neighbor Johnny and his wife are struggling with this. They're such good people and they do well financially. The stigma naturally sort of loses what it used to be. So I think it's gotten better, but it still exists. We see a lot more men come to treatment than women. Why is that? Right? Is it because women aren't supposed to have these problems and they don't want to admit to it? That's probably part of it, which doesn't make sense because, they suffer from this. I think if you look at the statistic, just as much as men do, but they're not coming to treat. We got to fix it. And that still bears itself out. If I look at Green Mountain census, it's typically 20 to 30% female, and the rest, 70% are male. Mm. Seems to me it should be 50-50, people that need treatment.
Yeah, that's an interesting observation. I'd agree with that, actually, definitely. It's nice to know, though, that things are at least getting somewhat easier on the stigma front. But sadly, as you said, because so many people are now being affected by this.
It's true. I think, and again, we open up the mental health facility, and that has less stigma to it than addiction, right? But they're both a disorder, an addiction, a mental health disorder. They shouldn't. People are more empathetic. From depression. Oh, how sad that is. Versus, they're using heroin. So I think it's gotten better, but we still got a ways.
Yeah, most definitely. Last question for you today. I ask all of my guests this because I get such an interesting and varied answer, but can you tell me your opinion of harm reduction and how it can play a role in recovery?
Great question. I think it's huge. I think, medicated assisted treatment has come so far as education and the research and the statistics that you can show the average person on why it works, because we now have the evidence that it works. And I'll be honest, I've evolved in this. I was kind of an old school guy 20 years ago, like it was abstinence based and you just stopped and maybe, 12-step work or what have you. But I was educated by people that were doing the work, mainly on the provider side. And with me, it sort of started with things like Vivitrol and Suboxone, where at one of our treatment centers I was working in Massachusetts, we really made an effort to get people that were leaving our treatment, whether it was alcohol or opiates or whatever disorder, to take Vivitrol. And my argument at that point was, it will buy you 30 days. For 30 days, you don't have to worry about this stuff. Maybe it will be longer term, but at least that window when you leave treatment, which is when somebody is the most vulnerable, if they have that medication that will work so they don't want to use or won't be effective to use, whether Suboxone, Vivitrol, et cetera, and I saw the results. I would have people call me 2 weeks later or a month later and say, hey, I'm doing well. So I saw that firsthand. And I saw other people that stayed on Suboxone or stayed on Vivitrol. And, there's other medications like methadone that have worked wonders for years. And I think some of those, we talked about stigma, people don't pursue that because of the stigma. I can't be connected to a clinic. Well, if it's making your life functional and you're participating and you're in recovery, so be it. You got this other medication working. So what? You're back with your family. You're doing well. You're participating. So, short answer: harm reduction. All for it. Certain levels.
I love that answer. Thank you very much. Do you have a message for anyone who's listening to this podcast who is going through addiction?
Yeah, you got to deal with it. It's not going away. It's easy to say. It only gets worse. It's a progressive disease. The AMA called it a disease because it's progressive and fatal if left untreated. And by left untreated means you continue to use. It just doesn't mean you go to treatment. It means you need to end the abuse of illicit drugs and alcohol. Deal with it. Your life gets so much better. I talk to so many people in recovery, not everything's wonderful. Stuff still happens and life is hard, but it's so much better than when you're in the throes of addiction. It's just light years away from those. I said the late 90s, man, never going back there. Things are so much better.
Wonderful. Last question. Can you tell our listeners how to best contact you and to find your service online?
Touched on it earlier. This thing is graniterecoverycenters.com, our website. And there's an 800 number. There's all kinds of pages to review what we're all about and what we offer. But the 800 number is the best way to talk to an admission rep. And if you are one of those people that are in the throes of addiction, we'll get you treatment. If you're a family member that's trying to get a loved one into treatment, we can navigate that as well.
Wonderful. Last question. Can you tell our listeners how to best contact you and to find your service online?
Touched on it earlier. This thing is graniterecoverycenters.com, our website. And there's an 800 number. There's all kinds of pages to review what we're all about and what we offer. But the 800 number is the best way to talk to an admission rep. And if you are one of those people that are in the throes of addiction, we'll get you treatment. If you're a family member that's trying to get a loved one into treatment, we can navigate that as well.
Wonderful. Eric, thank you so much for your time today. It's been a real privilege and an honor to talk to you and to hear about your own journey as well, and to hear about the amazing services that you and all of your team provide the community. It's been very inspiring. Thank you for your time today.
Thank you, Chris. I appreciate your time.